Welcome to the Family Star presentation of Florida Medicaid. What you need to know. In this presentation, we will be giving a basic overview of the Florida Medicaid system to help you understand the process. My name is Ria Ma, your digital presenter for today's event. Before we dive into the exciting and informative content we've prepared for you, here's a quick disclaimer. I'm actually an artificial intelligence designed and programmed to assist with sharing valuable knowledge and resources. I am here to provide evidence-based, up-to-date information and guidance, and will be sharing real stories from my colleagues at F&D. Here at F&D, we value honesty and transparency in all our interactions. We at the Family Network on Disabilities believe that the incredible advancements in technology, such as AI, can significantly enhance our ability to provide families with the resources, support, and information. All the information shared in this training comes from the dedicated team of experts at F&D, who have years of experience, rich understanding, and most importantly, a deep passion for supporting families just like yours. The Family Star program is a project of Family Network on Disabilities. We will be sharing more about F&D at the beginning and end of this presentation. We appreciate your taking this time to join us. We welcome you and encourage you to take notes during this presentation. We will be supplying you with contact information regarding this topic. Before we begin, I'd like to share a little bit about Family Network on Disabilities. We are a 501c3 nonprofit organization helping families across the state. We're funded in part by the U.S. Department of Education and the U.S. Department of Health through the Health Resources Services Administration. We use all of that grant dollars and funding that we get to provide information, resources, and support, and training to families, educators, professionals, and providers throughout the state. We do that at no charge. Family Network on Disabilities began in 1985 by a group of parents of children with disabilities who came together looking for mutual support. F&D is a grassroots organization for persons with disabilities and their families that is family-centered and family-driven. What makes F&D unique is that the majority of our board members, our management staff and program staff, are either individuals with lived experience with a disability or have family members with a disability, which gives us the perspective of empathy and compassion in the work that we do. At this time, I need to make a clarification. We are not attorneys, doctors, or mental health professionals, so we do not offer legal or medical advice in our workshops. But we are happy to support you with information, resources, and support. We use research-based information in our training and materials. Here is an overview of what we will be discussing in this presentation. We will review the application process. We will discuss the eligibility criteria for special cases and populations. We'll share about other medical service providers. We will clarify the process if you receive a denial after your application. And finally, we will discuss resources available to you. So let's begin. What is Medicaid? Medicaid is a federal and state program that provides medical assistance to individuals based on eligibility. Individuals must meet the eligibility criteria and income test for a specific coverage group. There are two levels of Medicaid. One is funding that comes from the federal government. The other is funding that comes from state funding. Medicaid and its services in Florida are administered by the Agency for Healthcare Administration, known as ACHA. In Florida, Medicaid eligibility is determined by the Department of Children and Families or the Social Security Administration, depending on the level of eligibility. There are groups of individuals who may be eligible based on special circumstances, and we will address those a little bit later in this presentation. Here are the Medicaid regulations. First, Medicaid coverage is authorized for 12 months for the individual, and in order to continue receiving coverage, applicants are required to renew their application each year. If there are any changes in the applicant's or recipient's circumstances, they are required to report that change to the Medicaid office within 10 days of the change, or it will affect their eligibility for benefits. Examples of changes might include pregnancy, birth of a child, receipt of new or increased earnings, termination of employment, arrival or departure of members in the household, changes in the living arrangement or address, or relocation to another state. Be advised that Medicaid is not transferable across state lines, which means that if you move, you must reapply in the new state. Each state has their own eligibility criteria and benefit programs. So how does one begin the process of applying for state Medicaid? You will go to their website, which is myaccess.myflfamilies.com, to begin the process. You will need to create a MyAccess account before you apply for the programs. ACCESS stands for Automated Community Connection to Economic Self-Sufficiency. We will continue referring to the account as ACCESS through this presentation. You will also be able to track your application through this account. Any changes and renewals will also be submitted through your ACCESS account. The quickest way to apply for Medicaid is from a computer with internet access after you create the MyAccess account first. You can also go to the Department of Children and Families Customer Service Centers to apply in person. Another option is to locate one of the many community partner networks which can assist you in the application process in person. You will need to complete a paper application by downloading and printing it. You can also mail the paper application to their office in Ocala, Florida, to the address on the slide. If you choose to go to a customer service center, you must hand-deliver your application. A final option is to call their customer call center by dialing 1-850-300-4323. What happens after I apply? Here are the steps to the process that we are going to review on the next few slides. Step 1. The application is reviewed to see if an interview is needed. Step 2. You may be asked to provide additional information to your application. Step 3. Your application will be processed. And Step 4. Your eligibility will be determined and you will be notified. Let's review each of these steps. So let's go over Step 1. This is when your application has been submitted and is being reviewed. In this step, if it's determined that you need an interview, you will be called within 5 days of receipt of the application to the phone number you provided on the application. If you can't be reached, they will leave a message and send a notice with contact information for you to reach them. During that interview, you will be asked questions about your household situation. You may also be asked questions about your identity and the documentation you supplied. During this step, if they determine that you need to provide additional information, you will receive a notice. In that notice, it will tell you what is required and give you a deadline in which you need to provide that additional information. Here are some examples of the information you might be asked to submit: proof of identity, citizenship or non-citizenship status, proof of earned and unearned income for each household member, such as pay stubs, child support, or veterans benefits. Within that notice, you will be given a deadline. It is critical that you adhere to that deadline or else your application may be denied. You can mail, fax, or upload your documents to your MyAccess account or bring the information to a local DCF office or community partner office. You can check your MyAccess account to confirm the information has been received and processed. Allow 3 to 5 days for this to take place. In Step 3, your information has been received and is being processed. Because everyone's needs are different, it can take some time for them to process your application. It can take around 30 days, or sometimes more, for your application to be completed and reviewed. If your case is eligible for disability through the Social Security Administration, it might take even longer. As I mentioned earlier, Medicaid application is through the federal program. If you are determined to be disabled and eligible for the federal program, you will be notified and your documentation will be transferred to that office. In Step 4, your eligibility has been determined. If you qualify for Florida Medicaid, you will receive a Medicaid card in the mail for all eligible household members in approximately 2 to 3 weeks after your case is approved. If you should need proof of your Medicaid eligibility after receiving it, but before receiving your card, you can print a temporary card from your MyAccess account. Now let's talk about the special groups that are eligible for Medicaid in the state of Florida. I'll review each of them on this slide and then go further in detail on the following slides. The special groups include family-related coverage, medically needy groups, non-citizens with emergency Medicaid, presumptive eligibility, and Medicaid access through Social Security. Let's dig into the first group, which is family-related coverage groups. There are several populations represented under this group. The first is pregnant women. Pregnant women, once qualified, can receive Medicaid through the duration of their pregnancy and 2 months after giving birth. The next group is coverage for parents and other caregiver relatives. In this case, they must have at least one dependent minor child at home. Parents and caregiver relatives, including their spouses, must be within the specified degree of relationship, which includes natural, biological, step, or adoptive parents, siblings, first cousins, nephews, nieces, aunts, uncles, and grandparents. Once the last child in the household turns 18 years old, a parent or other caregiver relative loses that eligibility for family-related Medicaid. The next group is for children under age 19. Medicaid may be provided to children under age 19 who are unmarried, not legally emancipated, or whose marriage was annulled. This includes children living with non-relatives or living independently. Following that is children ages 19 to 21. Medicaid may be provided to those individuals in that age category who are unmarried or whose marriage was annulled. Finally, we have continuous Medicaid eligibility for children under age 5 who became ineligible for Medicaid. They may remain on Medicaid for up to 12 months from the last eligibility review. Children ages 5 through 19 may receive a minimum of 6 months from the last eligibility review. I realize this is a lot of information to absorb. That is why we encourage you to go on the Florida Medicaid website. We will supply that website address again later in this presentation. Let's turn our attention to the medically needy group in the special groups eligible for Medicaid. The medically needy program can help pay for Medicaid-covered services for individuals enrolled in the program who have income or assets that exceed the limits for regular Medicaid. It is a share of cost program. That means a certain amount of medical bills must be incurred by the individual each month before Medicaid will cover it. It's similar to having to pay for a private insurance deductible before the private insurance will pay a percentage. The share of cost may be estimated based on the statement of your family's monthly income. In this case, paid and/or unpaid medical bills must be provided to determine if the share of cost you pay has been met. In the emergency medical assistance for non-citizens category, there are very specific requirements for the individuals. Non-citizens who meet all Medicaid eligibility requirements, except for citizenship status, may be eligible for Medicaid to cover medical emergencies, including the birth of a child. The non-citizen must file a complete application and provide verifications. A Social Security number is not required in this case. Non-citizens in the United States for a temporary reason, such as traveling for business or pleasure, are not eligible for emergency medical assistance or any other Medicaid benefits. There are several groups under the presumptive eligibility classification in Medicaid. Qualified hospital providers may elect to make presumptive determinations based on federal and state laws for the following individuals: pregnant women, parents, and other caretaker relatives, infants under age 1, children under age 19, and former foster care children ages 18 to 26. The presumptive period begins with the date the eligibility determination is completed by the qualified hospital staff and extends up to 1 additional month or until the application for full Medicaid is approved. Presumptive eligibility for pregnant women provides temporary Medicaid to pregnant women for immediate access to prenatal care. There are several specified providing centers who are able to determine this eligibility. Citizenship and non-citizenship status are not factors for eligibility. Presumptive eligibility for newborns, again determined by providers, goes through the birth month of the following year when born to a mother eligible for Medicaid on the date of the child's birth. Another group eligible for presumptive Medicaid are patients being treated for breast and cervical cancer. To qualify under this program, a woman must be between the ages of 50 and 64, be uninsured, be a U.S. citizen or a qualified non-citizen, and have income at or below 200% of federal poverty level. And finally, former foster care children who are under the age of 26 may receive Medicaid if they were in foster care under the state and receiving Medicaid until they aged out of foster care. There is no income limit for this coverage group. Other groups have different income levels applied to their eligibility. As I mentioned earlier in the presentation, there is a federal level of Medicaid. An individual receiving benefits from the Social Security Administration's programs, including supplemental security income or Social Security disability income, are automatically eligible for federal Medicaid, but income and assets still apply. If an individual's benefits through federal Medicaid terminate, Medicaid coverage will continue for 2 months beyond that payment end date to allow for DCF to review eligibility for other coverage groups. Continuous coverage applies to children as well if they lose their SSI benefits. You can review all of this information at www.ssa.gov. If an individual does not become eligible for Medicaid, there are other medical service programs available. The Children's Health Insurance Program, also known as CHIP, provides medical coverage for children under 19 whose family income is above the Medicaid income limit. The household is responsible to pay a monthly premium. Children who do not qualify for Medicaid or the CHIP program are referred to the federally facilitated marketplace. This marketplace is an online portal to assist individuals applying for qualified health insurance plans. Individuals may qualify for tax credits to help pay for the health insurance premiums. This is where the ACA program, also known as the Affordable Care Act, is available. You can find additional information at www.healthcare.gov. Children's Medical Services, or CMS, provides case management services to eligible children. This program is for children with complex medical conditions. CMS also provides family-centered programs to ensure children get the care they need. Eligibility is for children birthed through age 18 who have special behavioral or physical health needs or have a chronic medical condition. The CMS network provides access to specialty programs for child protection and safety, child and family information, early intervention and development, and newborn screenings. The Community Partner Network improves access to services by providing multiple local access points for families. By maximizing shared resources, the network increases customer access in 2 ways: self-service and assisted service sites. At the self-service sites, there is equipment for customers to apply, check the status. They provide general assistance in the application process at the self-service sites. In assisted service sites, they have the equipment necessary for individuals to apply, check status, or report changes, but they provide more intense assistance in the application process. A listing of community partners can be found online at www.myfloridafamilies.com. What are the steps to take if you are denied Medicaid? In this case, the Office of the Inspector General conducts administrative hearings on behalf of the Department of Children and Families. Everyone has a right to a fair hearing. You can request a hearing the following ways. Go to a local Department of Children and Families office. Call the Customer Call Center at 8504-881429 or email the Appeal Hearings section at appealhearings@myflfamilies.com. It is important to follow all listed deadlines. There is a time limit when an appeal can be made depending on program rules. Here are some websites for Medicaid resources. The main website for Florida Medicaid can be found at www.myflfamilies.com. You will find topical fact sheets and other resources at this website. The website again to open an Access account is www.myaccess.myflfamilies.com. Here are some additional resources to help you. Family Network on Disabilities is a statewide organization. Our website is www.fndusa.org. I'll be sharing more about us in a moment. The Center for Parent Information and Resources, which provides information related to education, can be found at www.parentcenterhub.org. Family Voices, a national grassroots network organization of families of children and youth with special healthcare needs and disabilities, can be found at www.familyvoices.org. Federation of Families, which provides education support and advocacy for children with emotional, behavioral, or mental health challenges, can be found at www.ffcmh.org. Disability Rights Florida is a statewide nonprofit that helps families navigate their legal rights for people with disabilities. They can be found at www.disabilityrightsflorida.org. This slide represents our F&D family. These are the programs housed under the Family Network on Disabilities. Each program provides a unique service to a specific population. There are 3 PTI programs, funded by the U.S. Department of Education through the Office of Special Education Programs. POP-IN serves North Florida. PSN serves Southwest Florida. and PIN serves Southeast Florida. The Family Star Program, funded by the U.S. Department of Health under the Health Resources Services Administration, supports families of youth with special health care needs. F&D also has a special needs trust where we provide families with information regarding creating and supporting a special needs trust. We also do programming specific to fathers raising children with disabilities. On this slide, you can see links for multiple downloadable resources available in various languages. You can also see some of our social media platforms. We have 7 pages on Facebook addressing the needs of different populations and our programs. I invite you to check out our website at www.fndusa.org for the hundreds of pages of resources and invaluable information that you can access and download at no charge. And finally, this is how you can reach us if you believe Family Network on Disabilities can help you and your family. Give us a call at 800-825-5736 and let us know your needs. You'll be assigned to a staff person who can support you. We want to thank you for spending this time with us during this presentation. We look forward to hearing from you if you believe F&D can help you.